and the posterior end does not lie in the same horizontal plane. It is more of like this. Okay, so these are the features for rib number 3 to rib number 9 for these ribs to be typical ribs. Now about the typical ribs. So in the typical rib there is this anterior end. Just stop writing. This is the anterior end, this part. This is the posterior end and this is the shaft. In the anterior end there is nothing but only a cup shaped small facet which is concave shaped, and that is for the articulation of costal cartilage. This is for the anterior part, anterior end. Then in the posterior end there is, this is called the head of the rib. This is the head, this part is the neck, this one, and this is the tubercle. A bony prominent elevation is there. This is called the tubercle. These three things are there on the posterior end. What is neck? Connecting the head with the shaft is called the neck for any bone. It is the definition. Okay, so first of all, we will see the head. In this head, you cannot see from the last bench, but there are two facets there. One is larger one. This is the larger one. The lower one is the larger one. The upper one is the smaller one. There are two facets there. And between them, there is a bony elevation, this one. This is called the crest. Okay, that is present in the head. So the thing is, they do articulate with the vertebrae. And how do they articulate? They articulate like, for example, this is the seventh vertebra. For example, this is the seventh rib. This lower larger facet will be articulating with the numerically corresponding vertebra. So if this is 7 and this is 7, this lower larger one will articulate with the vertebra like this, and the upper smaller facet will articulate with the vertebra above that. Okay, got that? Okay, this lower larger facet of the head will articulate with the numerically corresponding. हर एक के लिए एक है 12 ribs and 12 vertebrae. So 3 to 9, these are the typical. So if this is 7 and this is 7th, this lower larger one will articulate with the numerically corresponding vertebra, and the upper smaller one will articulate with the vertebra above that. Okay, this is for the head part. And between the two vertebrae there is a disc. What is that? Intervertebral disc. So when it articulates like that, the crest between the two facets, the crest that is present on the head will be on the same horizontal line of the intervertebral disc, like that. If you cannot see from there, but yeah, okay, this crest will be on the same horizontal line of the intervertebral disc. Okay, this is for the head. Then comes the neck. This is the neck of the rib. It is having superior border, it is having inferior border. What will be this surface? This is the anterior surface, this is the posterior surface. There is nothing much to say about the neck part. Then comes the tubercle. This one is the tubercle. In the tubercle, this part, there are two parts. One is non-articulating part, one is the articulating part. If I tell you that this is the anatomical position, this will be medial or lateral if I hold it like this part, this one and this one, okay? One is this one is this one, and the other one is this one. So this one, this will, okay, so the medial part is there for articulation. And what does it articulate with? These are the transverse process of vertebra. These things are called the transverse process of vertebra. This medial articulating part will articulate with the numerically corresponding transverse process of the vertebra, like this. Okay, like this one. Okay, if you can see, then it will be like this. Here there will be a joint transverse process and the articulating part. Then comes the lateral part, which is the non-articulating part. It doesn't articulate with anything. It is there for the accommodation of ligaments. There some ligaments are joining like transverse ligament. Okay. This is for the tubercle part. Then comes the shaft. This is the shaft part. It is having, what will be this border? Superior border. This is inferior border. This surface will be, this surface, if I tell you site determination and anatomical position, I will be telling you later after the class. But yeah, if I tell you this is the anatomical position, what will be this border? This is the medial border, which is concave or convex, and the outer border is convex. So the inferior border is somewhat sharp as compared to the superior border. If you cannot feel, you cannot know. But अभी के लिए देख लो. So the superior border is thick, and like the femur, the posterior border of femur, it is also having outer lip and inner lip. This is the outer lip of the superior border. This is the inner lip of the superior border. Okay. Now, there are some muscles. I hope you have seen in the dissection class that there are some muscles. What are those muscles? What? Okay. So suppose this is 7th vertebra. Suppose this is 8th vertebra. Okay. Sorry, rib. Okay. So this is the inferior border. Okay. There is this muscle called external intercostal. Okay. This will be originating from this inferior border, and it will go and join on the outer lip of the next lower rib. समझ में आया? The external intercostal will originate from here. Suppose this is 6th, this is 7th. Okay. The external intercostal will originate from the 6th, go to 7 and insert on the outer lip of the 7th. Okay. This is for the external intercostal. There are two more muscles that I will be telling you, but इसके पहले, this is the medial surface. It is having this groove-like structure. This is called costal groove. If you can see from the last, you will know, but I don't think you will be seeing that. So there is this groove-like structure. It is called the costal groove. Here, if you have the bone with you, you can feel that. These are also ceramic. Very good. So these are the costal groove. This is the costal groove that is present on the typical rib. These are there to accommodate three things: intercostal vein, artery, nerve. VAN. सबसे ऊपर there will be vein. इसके नीचे there will be intercostal artery. इसके नीचे there will be intercostal nerve. Then all of those will be present on the costal groove here on the inner surface. Okay. Now there are two more muscles. Internal intercostal. It will originate, suppose that it is the 6th rib, this is the 7th rib. The internal intercostal will originate from the floor of the costal groove here. From the floor of the costal groove and go and insert on the inner lip of the next lower rib. Suppose this is 6th, this is 7th. The internal intercostal will originate from the floor of the costal groove and go and insert on the inner lip of the 7th rib. Got it? Then there is another muscle that is called intercostalis intimus or innermost intercostal. That is originating. Suppose it is the costal groove. There is a border. This is called the upper border. Those who have the bone with them, they can feel. Other people just trust what I say. समझ में आया? You can see? Okay. So there is this upper border of the costal groove. This is the costal groove. This is the upper limit of the costal groove. So there is a bony elevation like structure. Okay. This is the upper border. From here, the intercostalis intimus or the innermost intercostal muscle is originating, and this is also going to insert on the inner lip of the next lower rib. Got it? Okay. These are about the muscles. Now, about the angles. This is the posterior angle. On the book, these are ceramic structures, so they don't correlate with the book, but in real life, it is written that from the tubercle, 5 centimeter lateral to the tubercle, there is this angulation where the shaft is making a sharp angulation with the posterior end. This is the posterior angle of rib, and that is the most common point of rib fracture. If for any reason, if your rib is fractured, this would be the most common site for your rib fracture. Okay, this one. This is about clinical anatomy. Now about the side determination. For side determination, again, if you hold a bone with the left hand, the examiner will be supposed to know that it is of left side. So yes, hold it with that hand only. So yes, this is left-sided. Why is this left-sided? In the exam, please at least know the points of every bone, each and every bone, the points for them to be right or left, the side determination points. Okay, first of all, anatomical position. First of all, the name of the bones, then anatomical position. Okay, and the points of side determination. If you are given this bone in the exam, you will be holding with your left hand and you will say, this is left-sided typical rib because the posterior end having the head, neck and the tubercle lies posteriorly. The convex part of the shaft will lie laterally and the concave part will lie medially, and there is this costal groove which will also be on the medial side, which is closer to the inferior border. These things you need to tell. For every bone, there will be 2 or 3 points of side determination. You need to know them all. Okay, after that, if you know the muscle attachments and all, you will be getting good marks, but this is the bare minimum you need to know. So this is about typical rib. Okay.